What if there was something you could do for your depression that worked better than any prescription medication at the pharmacy, had a higher rate of improvement of symptoms, and a higher rate of complete remission of your depression symptoms? Would you be interested in that? If so, hang out and watch this video until the end, because I'm going to tell you about just such an intervention that you can do at home without a copay or a prior authorization. I'm Dr. Ken Berry, a family physician. Let's talk about what you can do about your depression right now. You may have been reading in the media recently how it's come to light that the SSRIs don't really have anything to do with your serotonin whatsoever, and in many cases barely work better than placebo. Yeah, that's true. So what if there was an intervention that did not require you to take a pharmaceutical, that allowed you to change simple things in your diet at home that would give you a much higher rate of improvement of symptoms and also increase your risk of just having complete remission of your depression symptoms? Wouldn't that be awesome? There was a small study that was published recently that was performed in a university in France that looked at people with severe persistent depression and an intervention with a way of eating called a ketogenic diet. Now, before you click off to the next video, I know you've heard all the baloney about keto, about how it's bad for you, we don't know, blah, blah, blah. Well, this is an actual study where these patients were inpatients. So we know that they ate the ketogenic diet because they weren't provided with anything else. And in many of these cases, which I'm going to describe to you, their depression got markedly better or went completely away in just a few weeks' time. There's a new theory about depression, and the theory states that depression is not a mental illness. It's a metabolic illness that affects your brain and therefore affects your mental function. But there's nothing wrong with your brain if you suffer from depression. And I think that this study sheds light on that and shows that this theory is probably correct. Now, we already know since the 1920s that there's another brain condition that responds beautifully to a ketogenic diet, and that's a seizure disorder. So the thought comes, well, why couldn't it work for other mental health issues as well? And indeed it does. These patients were kept on a very delicious and whole foods-based ketogenic diet that totaled only 20 total grams of carbohydrates each and every day. These patients were kept on a ketogenic diet anywhere from weeks to months, depending on how long their therapy took. In this study, the depressive symptoms, both negative and positive, for every single patient improved within 2 weeks of being on a ketogenic diet. On both the Hamilton Depression Rating Scale and the Montgomery-Åsberg Depression Rating Scale, all of the patients on the ketogenic diets symptoms improved dramatically, much more than you would expect their depression symptoms to improve on an antidepressant medication. At the beginning of this study, the average patient in the study was taking over 5 different mental health medications. And at the end of the intervention, there was over a 64% decrease in the need for those depression medications. And also, they had to decrease their medications for hypertension, diabetes, and other metabolic conditions as well. Once again, bringing us back to the theory is maybe depression is a metabolic disease, just like type 2 diabetes, hypertension, or fatty liver. Now, I posted a link to the actual study itself in the show notes below, and also an article in Psychology Today describing this study and what it means. Dr. Dannon, the chief investigator, said that basically he had never seen an antidepressant medication or a combo of medications for depression improve the symptoms of depression and increase the risk of complete remission of depression than this ketogenic diet did. So if you know someone who suffers from depression, even if that someone is you, I would highly encourage you to ignore all the foolishness you hear in mainstream media about a ketogenic diet and realize that it is a therapeutic intervention for depression and many other mental health disorders as well. It will decrease your need for depression medication. It will decrease your symptoms of depression, and it's going to increase the chance that you completely put your depression in remission, aka you're not depressed anymore. Now, of course, we need more studies on a ketogenic diet and depression in a more controlled environment. That's true. But what would stop you from just starting a ketogenic diet at home? I obviously want you to be working with your mental health care professional, but ask them about a ketogenic diet. And if they express ignorance of that, you can print out a copy of this study and take it to them and say, man, I would really love to try just eating real whole food, basically meat and eggs and veg. If that would help my depression and I could come off of some of these medications, that would be amazing, because you may or may not know that many of the medications for depression that are FDA approved for depression, and then some that are used off-label like the antipsychotics, have a huge risk of making you gain weight, increasing your chances of having type 2 diabetes, hypertension, and other metabolic conditions. So if you could fix all that by just fixing your diet, wouldn't that be sexy? So if you're interested, I've got over 100 videos on this channel explaining how to do a ketogenic diet easily and inexpensively. Those videos will help you get started. And then when you follow up with your mental health care provider, you can say, hey, I'm going to try this real whole food ketogenic diet, and I want to work with you to see if I can improve my depression and get off some of these medications. Hope this video helps. This is Dr. Barry. I'll see you next time.